Why are brain metastases harder to treat than other metastases? In a previous video, we explained why breast cancer can spread to the brain. Brain metastases happen when cancer cells break away from the original tumour and travel to the brain, where a new tumour can grow. It is harder to treat metastases in the brain than in other parts of the body, because the blood-brain barrier stops most cancer medicines from getting into the brain to kill the cancer cells. Systemic treatments are therapies that work throughout the whole of the body. Most of the systemic treatments given in early and metastatic disease can't cross an intact blood-brain barrier. However, radiotherapy, and sometimes also surgery, may partially disrupt the blood-brain barrier, meaning that systemic therapies are more able to get across after treatment with radiotherapy. What needs to be considered when treating brain metastases? There are different components to looking after people with brain metastases, and sometimes they may be used together at the same time. One is to use medicines that treat the symptoms caused by the metastases, but these treatments do not change the size or number of the metastases. The other component is to use medicines, surgery or radiotherapy that target the metastases directly. These treatments aim to make the metastases smaller, grow more slowly, and reduce their number. This usually helps improve symptoms, and in some cases, the metastases can even be eliminated. If the metastases are small or do not cause symptoms, treatment may not always be started straight away. Treatment can be complicated because there are lots of things to think about, such as the size of the metastases, how many there are, and where they are in the brain. Other things that may change the treatment plan include what treatments have been given before and whether the cancer in other parts of the body is under control. Your doctor will discuss suitable treatment options with a team of different specialists and help to decide which are best for you. How are symptoms of brain metastases treated? Brain metastases can cause different symptoms depending on where they are in the brain. The skull is rigid and does not provide much room for brain metastases to grow. Some metastases can cause a build-up of fluid called edema, which can cause swelling, and the lack of space means that the brain is squeezed. The increase in pressure on the brain can give rise to symptoms such as headaches and seizures. Medicines such as steroids may be given to reduce the edema and swelling. Anti-seizure medicines or anti-sickness medicines may also be helpful. Treatments for the symptoms of brain metastases may help with quality of life, but they do not target the metastases directly. How are brain metastases treated? Surgery might be an option, especially if there is only one metastasis that is easy to access, or where metastases are causing complications. Radiotherapy kills cancer cells with radiation. If the metastases are limited in number and size, radiotherapy can be aimed directly at the metastases. This is called stereotactic radiosurgery, even though it does not involve a scalpel. The aim of stereotactic radiosurgery is to attack the brain metastases only, sparing the normal, healthy parts of the brain. When there are many metastases, radiotherapy might be given across the whole brain. This is called whole brain radiation therapy. There are ways of sparing important parts of the brain from whole brain radiation therapy to minimize side effects. Radiotherapy may disrupt the blood-brain barrier, making it easier for cancer medicines to get to the brain metastases. There are some systemic therapies and non-targeted therapies that can cross the blood-brain barrier. The biggest recent advances have been in targeted therapies. These are mostly drugs that target a particular receptor called HER2. These may only work on certain types of breast cancer and so may not be suitable for everyone. What does the future hold? New treatment options are being developed, including for breast cancer patients with brain metastases, and we are constantly learning how current types of treatment can affect brain metastases. Doctors and scientists are also looking into ways to prevent brain metastases. Life expectancy and quality of life for people with brain metastases have been improving in recent years, and these new approaches may help bring further improvements. If you have any concerns about brain metastases, please talk to your doctor or nurse.